Hi everyone, so we are talking about chronic pain today. Thanks for sending your questions in. And let's see. First, before we talk about chronic pain, we should talk about the difference between chronic pain and acute pain. So pain is important. It tells you when something's wrong. It tells you when to move your hand off of a hot stove. It's really important. Acute pain is when you hurt yourself and you feel pain. It, number one, tells you to stop doing what you're doing. And in addition to that, what you're feeling is you're feeling this rush of blood come in. You'll feel this swelling, inflammation, redness, whatever's going on. And it's going to bring a whole bunch of blood flow and the cells that are necessary to help you heal. All right, that's acute pain. Chronic pain is usually characterized by about 6 months or more of this like ongoing, usually low level, can be severe pain. I've heard some doctors characterize it as like 3 months or more, but usually it's like 6 months or more of like just pain that won't go away. So why is chronic pain and chronic inflammation bad for you? Well, chronic inflammation is bad for you. Let me see if I can fix my lighting a little bit. Chronic inflammation is bad for you because when you have inflammation means low level fire. So it's like this low level inflammation means fire, flame. When you have this low level fire burning in your body all the time, it's very bad for your body because what happens is it also makes you vulnerable to a lot of diseases, a lot of problems. It's the root of a lot of trouble, a lot of causes of trouble in your body. Now, the problem is that inflammation and pain, inflammation can actually exacerbate pain. So that's where the connection with inflammation and pain come in. Chronic pain, like I said, is characterized as 6 months or more of this sort of ongoing pain. So that was one of the questions is what's the difference between pain and chronic pain? So I think they meant acute pain and chronic pain. So you want to be able to feel pain. It's healthy. It tells you when something's wrong. But when it's ongoing, it can be a problem. Sometimes it's because your nervous system is like overreactive to something. Sometimes it's because you have a chronic back problem or something's going on. So really interesting study, the National Institute of Health, NIH did a study, and what they noticed was that the more severe the pain, the chronic pain that someone felt, the worse the overall health of the people were. So severe chronic pain was usually accompanied by older age, people carrying more weight, having other illnesses that went along with that. So that was really interesting. But here's what I thought was super interesting. You might find this interesting as well, especially in light of what we do at Amen Clinics. 2,400 women were surveyed, and 44% of the 2,400 surveyed had experienced emotional, physical, or sexual childhood trauma. More than half of those were like adamant that they do not believe that the two were connected. Now I gotta tell you, I was one of those people. I'm one of those people who, when I met my husband, I'm like, there is no connection to the fact that I grew up in trauma and drama as a kid. And, oh, by the way, at 4 years old, I went in for upper and lower GIs, and I've had gut problems ever since. I had cancer 3 times. Like, all these issues, I absolutely refuse to believe it. One of the reasons is because I absolutely hate the word victim. Like, I hate it with a passion. So, like, I would block this idea. So one of the reasons that women would block this idea that emotional or sexual or physical abuse as a child had anything to do with their pain is because they felt like doctors were minimizing their pain. They also felt like they were being stigmatized, or like me, someone was trying to force them into this like category of being a victim when they don't want to be made out to be victims. That's not what it is. It is in your head, but not the way you're thinking. What it turns out to be is that when you experience childhood trauma early in life, what happens is the brain rewires itself. Okay, so you have to run from a tiger. Let's just put it that. Let me just give you a different example than your childhood trauma. I'm just going to make it something very general. Let's just say you are on the street, yet like some tiger is after you and you almost die. Okay, that emotional trauma rewires your brain. Now, if that happens over and over, you become very hyper alert, hyper aware of tigers, okay? You're always looking for tigers. So you start constantly paying attention. Your stress response changes. It's not like a normal stress response in like somebody who's never been traumatized. Just ask my husband. It irritates the heck out of him sometimes. We'll be walking. I don't care where we are. We live in a really nice place. It doesn't matter. I don't care where we are. I am always looking behind me. I am always looking around. I am aware like of not even a real threat, but a potential threat that is like a very far off potential threat down the street, around the corner. Like I see that coming a mile away. I don't notice the really sweet stuff happening around me. I notice the potential threat. That's because my system was rewired. Does that make sense? That's what I mean by it's in your head. What that does, they now realize that that rewiring also makes you sensitive to pain. So there's some connection there that does that. So when they're trying to tell you to go get therapy, it's not because they think you're crazy. It's because you are actually more sensitive to pain, that you actually are more vulnerable to chronic pain. So I hope that that makes sense. And what's really interesting, my husband kept telling me, so you don't think there's any connection to all this stuff that happened when you were 4 and the fact that you had to go in for upper and lower GIs and you've had these problems ever since. I'm like, nope. But when I went in for EMDR, I ended up going in for some EMDR therapy for a couple of years. I have to tell you, like, it was amazing. I loved it. It's just absolutely incredible. And so it's pretty incredible what can happen. So EMDR, neurofeedback, biofeedback, those types of things can actually really help. Mindfulness training have been shown to really help people manage their thoughts, let go of past trauma, heal past trauma, and also affect how people experience pain, because pain is subjective. But when you settle down your emotional centers, it can really, really be beneficial. So one of the questions was, what are the most common chronic pain conditions? Low back pain is the most common. I know that for me, that's one of mine. I have scoliosis, so that's probably why for me. And I like to practice karate. Go figure, right? So that's my therapy. I like to go hit stuff. So probably not a good idea when you have scoliosis, but I love it. So low back pain, migraines, and neck pain are the top 3. Then it goes on and on. Fibromyalgia, sciatica, other aches and pains, joint pain, things like this. So women who had been abused as children, not just women, it was actually children who had been abused, but the study, there were more women who reported it. So women who had been abused actually reported more things like fibromyalgia. They also suffered more from like chronic fatigue syndrome, things like this. So the next question, can chronic pain be treated or alleviated? Yes, it just depends on what you want to do. A lot of people put Band-Aids over them by taking excessive, either over-the-counter or prescription pain medications. I'm not saying that's not going to temporarily take you out of pain, but it also comes with a host of side effects. I'm not here to tell you what to do. I'm just here to share information with you. So I'm not a doctor. You need to go see a specialist. I'm just sharing information with you. Obviously, we deal with a lot of this stuff at our clinics, so that's why I'm sharing it with you. So pain management specialists, I actually worked with a lot of these. I worked for a company called Medtronic when I was working as a nurse a long time ago. And they did pain pumps. Medtronic does pain pumps. But there are pain specialists that have a whole bunch of treatment options, including things like, medications, opioids, pain pumps, things like this. But you also have to understand that there are side effects to some of the things, like whether it's steroids or pain medications or even over-the-counter anti-inflammatories like NSAIDs. So NSAIDs can have, let's just say that that's a place that you start. NSAIDs, you can get GI bleeding. It decreases your good gut bacteria, which then can help, lead to problems with your brain. So anxiety, depression, stuff like that. So you just have to know. You have to know what the side effects are. Steroids affect immunity if you're taking them systemically, not topically. You can't take them long term without having some sort of a problem usually. So you need to know what you're doing, work with someone who really knows what they're doing, and you still want to be thinking, what's the root cause of all of this pain? What is it? Emotional trauma? Maybe I should go get some, treatment therapy, some modality to help me heal the past. Or is it something like scoliosis? Or is it something like, whatever it is that you've got going on? But one place I want to talk about that most people don't talk about, how about an anti-inflammatory diet? Because I have to tell you, I've been doing this a long time. I've done the nutrition and the diet programs and written 8 books. I do the program that we use in Amen clinics. And one of the first things I get as far as feedback when I work with people and do our classes is my fibromyalgia is better. My pain is better from improving their diet. Why? Because of that inflammation that I told you about before. That anti-inflammatory property. When you decrease inflammation, you improve the way your joints work, the way you feel, the way you sleep. Not sleeping is also going to cause problems with pain. So that's why we want to, it can't hurt you. There's no side effects to eating healthy, okay? So if you're getting side effects to eating healthy, then you're not actually eating healthy. Does that make sense? So an anti-inflammatory diet is a great place to start because there are no side effects. Things like herbs and spices are amazing. Curcumin, awesome. Herbs and spices are just incredible. Garlic, oregano, basil, incredible. And they can't hurt you unless you are allergic to them. If you are allergic to them, don't eat them. Focus on the other ones because there are so many. And I write about herbs and spices in the Brain Warriors Way cookbook extensively, tell you how to use it, what they do, why they're good for your brain. So just start getting used to using some of this stuff. It's just an easy way to do it. So let's talk about some other things. How about physical therapy? Let's talk about other treatments and also some alternative therapies. Physical therapy, I love. If you need to fix something rather than just covering it up with a Band-Aid, physical therapy is great because so often the root of your pain is caused from an imbalance in your body. Either your posture's bad, you're weak in some area. I know I had that problem. I didn't even realize it because I work out every day. I was overworking certain areas and not working other areas enough. Well, how would I know that? I'm not a physical therapist. I'm a nurse. So I went to a physical therapist and figured out that I was actually not training right. So it's really important to know that. And I really love, for me, I love going to the chiropractor. Not everybody does. You need to do what's right for you and know what works for you. My chiropractor, it just saves my back. I love going to the chiropractor. But my chiropractor doesn't just do chiropractics. They do acupuncture. And something new that I just tried, I actually just tried it for the first time, and I could not believe that it actually helped, was cupping. Unbelievable. I'm like, you're going to put cups on my back? What the heck is that going to do? Unbelievable how good it felt. So there are so many things, and I have not done a lot of acupuncture myself, but we have patients that literally just swear by it. So of course, you already know how I feel about meditation. I'm doing a whole series on meditation because I have a couple videos on meditation that I've done to help people get started. And now I've got people just requesting more of those. Meditation has been actually shown in studies to help people decrease their pain, improve stress, improve sleep. So many benefits to meditation. So really want to encourage you with that. Cognitive behavioral therapy. I already talked about biofeedback. So pain is real. It's there for a reason. The reason may not always be what you think it is. Maybe your back is hurting, but maybe it's accelerated. Maybe it's actually exaggerated. And I don't mean exaggerated in a negative way. I mean, maybe your pain is heightened because maybe there's something that you didn't take care of that you need to be taken care of from the past. I'm just saying, I don't know you. Just think about it. Be open to the idea. So a couple of other questions. Do I have chronic pain? I don't know. Has it been going on more than 6 months? Don't know. Is there not something obvious that needs to heal that has already healed and is the pain still going on? That's how you can know. How common is chronic pain? How about this? 11.2% of Americans experience chronic pain, at least moderately. But 17.6% of Americans have said they experience severe chronic pain. That's pretty crazy. Now, what is the scale to measure that? The scale is subjective because we all experience pain differently. I have a very high pain tolerance because I just choose to block it out. I experience pain a lot of the time, but especially with all the health issues I've had, I would tell you it's a 2. Someone else might tell you that same pain is an 8 on a scale of 1 to 10. It's different. That doesn't mean that one person is a baby and the other person is a stud. That's not what it means. We all actually have different ways that we feel pain, our pain receptors. So it's very different for people. Mentally, we experience it differently. Physically, we experience it differently. So try to be sensitive to people when they tell you that they're experiencing really bad pain. They may actually be experiencing pain very differently than you might. So just know that. I have to be really careful because I have a pretty high pain tolerance. My daughter has a really high pain tolerance. So I've almost missed taking her to the doctor. Do you know she walked around with 2 broken bones in her arm for 3 days when she was 4 years old? 4-year-old. She fell out of bed and she wasn't complaining. And I didn't know. And she actually went to a dance recital. And then all of a sudden, a few days later, it started to swell. And I realized she couldn't twist her wrist all the way. And I'm like, holy cow, I felt like the worst mother on the planet. The kid has a crazy pain tolerance. So you have to be careful. That doesn't necessarily mean it's a good thing, obviously, because you could miss something really important. So the next question, how does chronic pain affect families? I think they mean, why does chronic pain affect whole families? I think that's what they mean. It could be genetic. So maybe there's some genetic condition. Maybe it's the food you're eating. Maybe you all are inflamed. Maybe you have inflammatory issues. Could be stress. Maybe you have trauma. So in my family, trauma and drama was a norm. They actually thought it was normal to just carry on with that kind of like chaos all the time. It was just insane. So that actually increases how you feel pain. Someone said they've been advised to keep a pain diary and they don't know what it is. So a pain diary, you can actually buy a pain diary on Amazon. That's what I would do, or download an app. They have apps for pain diaries, like how to record pain for a physician or for a practitioner. What that is it's a way to be very specific. If you walk into a doctor and you say, oh, pain is the worst it's ever been, I don't know what to do. There's no doctor that can help you like really zero in on that. So to really help your practitioner, a pain diary is going to help you zero in. When are you feeling pain? Because what you're going to start to notice is there are patterns. Just like I have people keep food diaries, okay? There are patterns. When are you eating certain things? When are you feeling sick? When are you overeating? Same thing with pain. When are you feeling pain the most? What are you doing that helps? What are you doing that hurts? What are you doing to treat it? Okay, what are the side effects? Okay, so that's what a pain diary is. What is your pain on a scale of 1 to 10 when you're feeling it? That kind of stuff. Is it a sharp pain, dull pain, blah, 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 blah. It's on and on. So just so you don't forget something, I'd probably get a real pain diary rather than trying to remember it all yourself. I don't think they're very expensive, but you can make one yourself. Someone asked if they should see a pain specialist. Depends. It depends on the pain, how long you've had it, and what you would like to do about it. I think pain is there for a reason, so maybe you should check out. We often say you can't change what you don't measure or what you don't know. So you might want to know. I've actually heard so many stories as a nurse. People thinking they had GI pain when it ended up being their uterus. Right? Weird. How would you know that if you didn't actually check? Or, in my case, having thyroid cancer and not knowing it, I didn't know for years that it was actually causing other problems. So you don't know unless you go get checked. So strongly suggest you do go get checked. So let's see. Why are some pain medications available without prescription and others aren't? Well, controlled substances and opioids are always going to require a prescription. Usually medications that have a lot of side effects or that require a physician monitoring you, or things like steroids, because they can really cause problems in your body. They have a lot of side effects if they're not being monitored and they're not being taken correctly. Those are going to be medications that require a prescription. That does not mean that over-the-counter medications don't have side effects. Please hear me clearly when I tell you this. NSAIDs, which is things like Advil, have side effects if you don't take them correctly, okay? Or if you don't know what you're doing. If you're taking them at the wrong time. If you're taking high dose, if you're taking 800 milligrams of, say, ibuprofen or Advil 3 or 4 times a day, or 3 times a day, let's say 3 times a day, you shouldn't be taking it more than that anyways, and you shouldn't even be taking it that much chronically. But if you're doing that and you don't know that you shouldn't take it before some medical procedure, you can bleed. Okay, it causes bruising, bleeding. It also can cause GI bleeds. decreases good gut bacteria. So over-the-counter medications can have a bunch of side effects if you don't know what they are and how to use them correctly. So I still suggest, if you're having pain, have someone advise you if you don't know how to do this stuff, if you don't know how to use this stuff. If it's not your job to know how to use it, make sure you're talking to someone whose job it is. I hope this was helpful. If you need help finding a therapist, you can call our clinics. If you aren't close to one of our clinics, we actually have a whole network of people that we know that we can refer you to. If you need someone to help you with testing, things like that, please reach out. Have a great day. Bye-bye.